Thank you, everybody. I think it's, good afternoon, everybody. I think it's more fair to say that there were, as always, a lot of people doing this. My name sounded too much already. I think it's important because nothing in our world is only because of one person. It is because of more people, okay? I've done my homework today, and I've done what we always tell fellows to do, which is basically to do some customer discovery. So I've talked to people who have done the program over these years, and I'm going to be sharing you some stories, hopefully not just entertaining, but that will bring some insights that you can bring back home, okay? So if that sounds like a promising plan, let me start. But I'm going to start before saying thank you to three thank yous to Biocat. The first one is for the kind invitation to speak today because it's a 10th anniversary. We were talking with Robert. It only means that we're getting older, okay? But it is a success when things reach a significant figure like 10, okay? Stanford Biodesign is reaching 25 this year, so, you know, we have another, goal over there. So congratulations for that. First, thank you from my side. Second, thank you to Biocat for continuing the two programs that I brought, not just the D-Health, but across Barcelona, just to continue them because it's important. I always think that if when you leave a place, the thing stops, it means that the important person were you and not the program, okay, or the project that you were doing. And I think this proves that when I left, a lot of the things could happen, progress has happened, new things have been brought, and I think this is important. That's how progress happens, okay? So that's the second thank you to Biocat. And then the third thank you is to the pioneers who were there, because we are here celebrating, right? But it is always we forget about the people who were there those days, right? And then basically these are the people who we were trying to find ways. 13 years ago, there was really not the clarity that we have today, of course, right? And I'll share a little bit of that. These people, some of them have transitioned from Biocat to other places, and we have continued working on the ecosystem because that's how you strengthen an ecosystem, getting them together to continue doing things. Of course, some of these pictures are from old days, as you can notice, okay? Some people are older now, but I think I wanted to be kind to them today on that end, okay? Very good. So let's kick off, and that's, to me, this is important because ideas always, in the beginning, they have lonely childhoods, okay? So it's very, very difficult to ramp up new things, really, really difficult. Everybody attacks new ideas from the beginning, and these were the pioneers at that point in time, okay? So with that, I have structured the presentation into three parts. It's all full of a story, so hopefully that is entertaining. The first is why this was created 13 years ago. It was 2012, 2013, okay? And why it is still relevant today, right? The second is I have chosen 10 key people in the program, a lot of them from Stanford Biodesign, but from some other institutions here as well. And then some insights that I learned from them that I think would be interesting and useful in your careers down the line, right? And then 3 takeaways from former fellows, let's say wisdom nuggets that I want to pass over to you. Okay, so I hope that this is interesting and makes a good program. So why we started this, a little bit of history, right? So basically, I remember Montse Vendrell, she called me and she said, she was the CEO of Biocat at that point in time, she said, hey, we have some money from, I think it was from the Spanish government, to do an innovative education, right? And this was 2011, more or less, right? And then he said, well, I know that you like these things, why don't you help us trying to do that? And I said, okay, but what it is that you want to do? I said, I don't know, but something that is truly innovative, something that is different that we don't have here in Catalonia, okay? So we started looking into things. We looked into, I think I have a spreadsheet of 150 programs that we looked into the world, right? And we spotted into this one, right? Stanford Biodesign, right? And I remember the first person I talked about this was with Luis Paredes from In Vivo Partners. Luis had at that point in time written a book called whatever. It's a thick book. I don't remember the title, right? And a few months later, I say, hey, Luis, I found this. Have you read it? I said, not, but this is really the book, okay? So what we liked about that was that by that point in time, they've been already running it for 10 years, so they had experience. Not only that, they had consolidated the experience and put it in a book. That's the first edition of the book. It's called, in regular terms, it's called El Ladrillo, the thick brick. Okay, I think only 2 people have read it, just at least that I know, okay, fully. So and then the other beauty of the program was that it put hospitals at the center of innovation, right? It was a point in time where Biocat, the bio of Biocat was very much still biotechnology. So it was the red, the blue, the green, the yellow, the different technologies, right? And then Biocat under Monse was trying to move towards more biomedicine, right? And that was an important thing because if you read the reports from Biocat on those days, it was mostly about biotech and research and not about the whole ecosystem, which is something that now I think Biocat represents the whole ecosystem. And I always got the yearly event, the small JP Morgan of Catalonia, okay, which I think it is totally true, right? So we did that. We decided to get this name, D-Health Barcelona, because the people from Stanford told us don't use biodesign, so we went for that. Funny thing, I'd just been to Singapore a month ago or so, and I met the people who gave me the name of D-Health Barcelona because, you know, I went to a meeting in Denmark. They were there also doing it, and they suggested the name and said, why is D-Health? Is it because we're in Denmark? I said, no, design health, because design is important, design thinking. I said, oh, okay, that liked it. And then, you know, we liked it. So it was a postgraduate program to develop entrepreneurs and creative leaders in healthcare innovation. It was 9 months. It was a full-time, full-life program, okay? And this was the commercial advertising for the second year. So these were the 12 first fellows that came in, right? Now, 5 things that we wanted to achieve, very important. The first ones, we wanted people to experience a full cycle of innovation, right? Remember, this is 2012, 2013. Not a lot of people had experienced a full cycle from beginning to end. There were a lot of gaps in the process. So we really wanted people to experience a full cycle of innovation, right? From need identification in clinical settings through invention and development in early stage implementation into the market. Okay, that was the thing. You know, the famous 3 phases: identify, invent, and implement, right? Very, very strong, the identifying and invent phases. You see that there is recurrent and iterative flechas, you know, coming up and there, and then the implement side, right? This is a very strong methodology, but when I started it, I found that the last piece was a bit weak, right? And you tell me, how is it possible? Stanford Biodesign at that point in time for the 3rd phase, they wanted the students to do a business plan, so a 70-page document about things, right? Which I thought that was not the right thing and that we should go into more the lean launchpad methodologies, you know, testing, you know, validating before building, right? So we invented that. I think this is going to be important down the line, okay? And we wanted to continue this process, you know, providing them with just-in-time knowledge. Not just in case knowledge, but just in time. As they were progressing, we were giving them the knowledge that they need to be able to progress that, okay? First thing. Second one, knowledge. You know, after this market research we did, there were 150 programs. There were top programs, but they were only talking about 1 or 2 of these industries. And it's very important if you want to innovate in healthcare, you need to understand the full ecosystem, right? Why is that? Because in order to be a good innovator, entrepreneur, you need to know, you need to have in-depth knowledge of the players, the industry dynamics, the economic structure and incentives of each. Because if you're selling to hospitals, you need to understand that. If you're selling to pharma, you need to understand them, etc. Okay? And it's important to understand that although we call it a healthcare industry, it's more healthcare ecosystem in the sense that it's an interdependent system that my profits are your costs and your profits are my costs, right? So we need to understand that. So knowledge was the second thing we wanted to give. The third one was we wanted people to work in multidisciplinary settings. This was something that we learned from Stanford, right? And that was very important. If I ask you, do you know who are all these people? Can somebody raise hands? Who is everybody? No? What? Watson? Crick and Watson, good. What? Rosalind Franklin, the lady, always forgotten, very good. The one in the middle, Maurice Wilkins. These guys, what do they have in common across the centuries, the last 3 centuries? First, they're doing discoveries coming from a different field. John Snow was a doctor. He was doing geography maps, you know, trying to spot where cholera happened in London in 1852. You know, people believed that cholera happened because of bad air. You know, he discovered it was because there were bad wells of water in a concrete place in London. Okay. Second one is the people who discovered the ADN, DNA. Okay, structure. As you can see here, Francis Crick, he wasn't a biologist by training, he was a physicist. Rosalind Franklin, he was not a biologist either. He trained in physics and chemistry. So people really breaking the boundaries, right? And the guy over there, he's the CEO of Google DeepMind, Demis Hassabis. He's Nobel Prize in chemistry. He never studied chemistry. Okay, he's a computer scientist, right? So it's an interesting take there. So we want a team to get over these things, working with teams from different places, right? Why is that? Because where disciplines collide, breakthroughs begin. They start to happen. Okay, that's very important because then new things take place, right? I always tell this story that my worst employment moment was a European project. Okay, I still have the name in my brain. I'm not going to say it now. But it was a project that was about business models, so it was something that I'm comfortable and I like. The whole project was in English, so we were all comfortable with the language, but it was a disaster in the project. Why is that? Because we were not able to communicate it. We don't have good terms for that in English, but in Spanish we have this difference between idiomas and lenguajes. We could be having the same idioma, we could be talking in English, but we have different languages that we don't share, then communication is impossible, the breakthroughs don't happen, collation doesn't happen, okay? And this is the typical day of an innovator or an entrepreneur. You have to screen legal documents, you have to talk to scientists or doctors, you need to discuss technology with the IT teams, you need to protect your intellectual property and discuss this with IP lawyers, you need to discuss the boring regulatory stuff, you need to run spreadsheets, and you need to do also business model stuff rather than commercialization. So you really need to do a lot of things, and you need to know all these languages. So we wanted teams to have this specific knowledge, right? And then, of course, developing soft skills. Soft skills, some people say that they are easy skills. We know that soft is hard, okay, really, really hard. If I could only, improve on something in my life, that would be these soft skills, right? We wanted teams to, to be more fluent and in different ways of thinking, fast and slow, internal and social, converging and diverging. Okay, very, very important, this thing, right? And then last but not least, we wanted to build a community, an ecosystem, okay? As I said, Biocat was very much centered around, let's say, the research area, and we wanted to connect all these people. In fact, this is a slide from those times. We said our mission is not to build better entrepreneurs, our mission is to make the ecosystem stronger. And I think that was still the case, but that's the thing, okay? So these were the reasons why we did them, right? And I think they are still relevant today. Now, 10 key lessons from 10 key. How are we doing today? I'm over excited because I have too much coffee today. I had some troubles with my flights. How are we doing? Okay? All good? Yes. People over there, I know you're saying yes, but you're not paying attention to me. You're rehearsing your pitch on your way. I've been there. It's totally fine. You're very polite looking at me, but that's totally fine. 10 key lessons from 10 key people, okay, in the program. First lesson, it might sound a bit strange, but you'll get it. This is kindness is the highest form of intelligence. Why do I say that? This is Paul Yock. This is the bioengineer. This is one of the co-founder and director of Biodesign. This is the guy who invented it, along with Josh McCover. He's a top guy, okay? He's really what we call what Americans will say, an accomplished individual. Really, really a top guy, okay? And I remember we were going with Monse to this event called BME Idea, which is a yearly event that started to happen in Europe at that point in time, right? And then I was scared to hell because I had to present what we had done at Biocat with biodesign methodology, that we had tweaked his last part, because we didn't ask students to write a business plan, but to do business model work, right? So basically, I shyly told him, right, hey, we did this, I hope that is okay. And he was really, really, really open to this. I was not accustomed to the American academics, which are very different from the Europeans. Very open. He said, yes, please share your feedback with me. Let me know how it went. I'm really interested because we want always to evolve the methodology. So very, very interesting. And I remember we were talking with Monse over dinner about that, and he shared this idea with me that I found later online. Best advice she got when she entered academia: we are all smart over here. Distinguish yourself by being kind. Okay, it is true. Our world is full of smart people. Distinguish ourselves by being kind. Okay. Second idea, from intelligence to ignorance. Ignorance is more important than we think. Let me explain that. Why is that? This is Todd Brinton. He's an interventional cardiologist. This is what I would call another accomplished individual. Okay. This is the guy who I trained with. You know, I spent a week in Stanford training with the methodology, right? He was the fellowship director for 13 years. Now he's the chief scientific officer and corporate vice president for Edwards Life Sciences, so a top guy indeed in the industry, right? So basically, Todd, I mean, he is a biomedical engineer by training. He's a doctor. He did his medical residency in Chicago. He completed internship in Stanford. I thought he was an MBA from Stanford. I just discovered yesterday that he not. But at that point in time, when the story I'm going to be telling you happened, he said, I thought he was an MBA from Stanford. So basically, he had everything, and I am a poor guy from Oviedo trying to put up this program, right? And so I said, hey, Todd, you know, great methodology, thank you. It's been great the week, but you know what? I don't think I'm going to be able to do this because I don't have your skills. And I just don't know everything you know, right? You're a doctor, an engineer, you know everything about economics. He said to me, Jorge, we don't help teams by what we know. I said, okay, very interesting. So what? He said to me, we help them by what we don't know, okay? Basically, what we do is we ask questions to try to understand what is missing out there, where the pieces don't fit very well. Okay, and I have used this approach because this idea of moving from not knowing into knowing, very, very important. Okay, and this is useful for many things in your life. You know, from parenting to working in different countries. You know, we do not help teams by what we know. We help them by what we don't know. You know, it gave me great confidence, and I think I need to thank him for that. So very good, very good. This. Third insight, innovation starts with correctly defining an unmet or underserved clinical need. Robert was saying that already before, right? A well-characterized need is the DNA of a great healthcare invention. This is the foundational mantra of Stanford Biodesign. Then you do the need identification, and then the need screen. The need screening is a very rigorous process of filtering and ranking a collection of needs, identified needs, based on objective and not subjective criteria. Okay, that's very important, right? It is so interesting as a methodology that you can use it in other places, you know. For example, I don't know if you know Corbin. Anybody here loves wine? Okay. The lady in the white, she's like, I love it, right? Anybody knows this thing, this device? Anybody has one at home? You have one at home? Okay, very good to know, very good. So this is, the lady over there, you know, knows that. So this is, Corbin is a company, this is the device, it's a very strange device that was developed with the methodology of Stanford Biodesign. Who did this? These two guys. The guy on the left is Greg Lambrecht, right? Basically a nuclear and mechanical engineer who was working with the guy on the right, which is Josh McOver, who was the other co-founder with Paul Yock of the methodology. Okay, they worked together in Pfizer. Greg was in love with wine, so is Josh. But Greg had really a passion for wine. The problem is that his wife was pregnant. So basically they were opening bottles of wine, you know, drinking maybe one glass or two and then throwing the rest, right? So he said, no, it has to be another way, right? So they developed this methodology, right? Very interesting, you know, because that's how it starts, you know. If you start with a nice statement that says, we need a device that allows wine to be poured through a cork, this is wrong from a biodesign perspective because basically you're embedding a solution into the need statement, okay? If you go something like a way to help wine enthusiasts consume individual servings from unopened bottles without degrading the quality of the remaining wine so that they can enjoy wine more flexibly over time, right? This opens a total different, you know, space of enjoying and creating solutions, right? So the methodology works for lots of things, right? Now that we talk about wine, Robert goes. Now he's going to the winery, right? Number 4, trust the process. Very important. This is a classic in biodesign. You need to trust the process because you really don't know what is coming. Really need to trust the process, okay? And another person who really got me to this is Luis. I think you've worked with Luis? Okay, very good. Good. So, you know, I said, hey, Luis, how are we going to do that, you know? Because in our time, the clinical immersion lasted 8 weeks. So we had 80 clinical needs every week, right? So we had to review all of them. And then he said, Jorge, the only way to refine your skills is to do it over and over and over. And I remember by the second or the third year, I was able to discuss the needs, right, with the teams. And when they were thinking in my response, I was already looking to the new need, right, to the second need, right? So you develop a methodology, becomes a second nature into that, okay? So very important you do it over time. You need to trust the process, okay? Number 5, looking is not seeing. This is exactly what is happening to the group over there, right? So you're looking, but you're not seeing. That's totally fine. You know, this is for you. No, story comes from this guy, Dan Azaguri. He's married to a Catalan. He was part of the expedition, if I'm not wrong, Arnau, when the Presidentilla visited Stanford last month. He was a fellow in 2011, very nice guy. And he became the fellowship director when Todd Brinton left, okay? He's also a startup founder, and he's a top bariatric surgeon in Stanford, right? He was the keynote for the opening ceremony in 2013, and basically he told a story that stuck with me a lot, right? So he said, hey, Dan, how do you do that? You're a doctor. How do you do this, you know, clinical immersion? When you go there, you know, your eyes are dirty. No, it's not like that, Jorge, he told me. Whenever I go there, I have a different approach because I'm looking at things, I'm not performing, right? And then I am going with other people, you know. And then, for example, last time I was with an engineering, and the engineering started asking me questions. So who is this guy over there? Why are there so many people? What is this machine going over there? Why is this blue and this white? And what's going on here? So I was explaining, and then at some point, and he said, and wait a second, what is this thing that you're doing over there with the hand of the patient? And they said, no, we are taping the hands of the patient because we're going to, do surgery on him, so avoid that the hands fall down, okay? And then, the engineer said, and with all this technology and so many smart people in the room, you have never thought about anything better than a plastic tape? You got to be kidding me, right? So for the engineer, that was not possible, right? And why was it? Because that was always the way that they were doing the things. That's always the case with innovation, right? So sometimes you don't see things, you hear them. For example, I remember telling me that sometimes you just don't need to close your eyes in the operating room. And when you close your eyes in the operating room and you pay attention, then sometime you'll hear something like, which is the sound, the surgeon that is pissed off at something, okay? So you need to find out what is he's pissed off. Because he's fully concentrated, he'll not say fuck off or something, but he'll say, okay? So this sound, can point you to an unmet clinical need, okay? Number 6, innovation is a necessary conditions game, not a sufficient conditions game. This is Anurag Mairal, very smart Indians. Indians are very smart, you know that. He's the director of global outreach programs. I think he's being always there. This was at the CCCB. This was 16th of April, 2013, okay? He looks very young here already, right? And, I got 2 ideas from him that day. The first one was precisely this. He had a slide. He said, this is our real product. It's not the companies, it's the people. Very important, okay? People is the outcome of this program. You need to focus on that, okay? And the second, he said, there are 2 major objectives on any healthcare system. One is doing things better, outcome improvements. The other is doing them cheaper, cost control, okay? The days where you can only maximize one variable are over. You need to maximize both variables at the same time. And this is difficult because in science and research and in healthcare, we're quite accustomed to do this, just maximize one variable, but not 2. Maximizing 2 is very complicated, right, at the same time. So it doesn't really matter how good your solution is if it results in additional costs. A hospital will never buy it, okay? So innovation is this 2-level game. You need to be better, your solution to be better and cheaper, okay? Number 7, in innovation, not all the knowledge is codified, okay? Let me introduce you to another guy, Big McRae. He used to be also, I think he attended with Dan Azaguri. He created a company called Tangible Sciences, and he's today the medical officer for Intuitive Surgical, okay? And I was having a conversation with him over dinner in Denmark, where we gathered together to learn from Stanford Biodesign how to do it. And then he was using this word, the shrink. And at some point I said, okay, but what is the shrink? Okay, I've read the fucking book. There is no reference to the shrink. What is the shrink? I didn't even know the name in Spanish, okay? So the shrink apparently is el loquero, okay? If I got it correctly, okay? So I said, what is the shrink? Oh, the shrink is we got a teacher, a professor from organizational development department who helps the team develop and grow over time, because you need people to work on the process and people to work on the development of the team. There's 2 different things. You won't be able to do that. We talked to the people in Ireland who had already done it 1 year, and they said, you need to have this. You need to have one of these, right? So we recruited some people, the house pilots and the Anasansos, some of you will know, these are the people who really help the teams work on their skills, their soft skills, the check-ins, the yes and the different things, right? 3 ideas from House Pilot. The first is a team is not a group of people that work together. A team is a group of people that learn together, specifically in innovation and research. Very important. You need to be learning together to move things forward, right? The problem with teams is that they bring both the best and the worst out of people, right? Specifically of talented people, very important, right? So it's really an asset to be able to learn to disagree without being disagreeable. Without being disagreeable, there's a typo there, okay? Disagree without damaging the relationship. That's very difficult. How do you tell someone that what he's saying is not correct without damaging the relationship, right? So that's something to do that. And then Diana basically, taught teams how to ask for permission with feedback. You need to ask people, are you ready for feedback? Maybe people are having some difficulties, right? When there is positive reinforcement, you should be giving it in public. When it's constructive advice, it should be done in private. Okay, very important. So we had these people were doing the shrink for us a lot. Okay. Number 8, diverging before converging. This is very useful from Stanford Biodesign and the design thinking in this concrete case. This is Lesh from the Kerr Lab. It was called Fuel 4 at that point. I think she is the one who has trained almost everybody in our community to do design thinking in healthcare the proper way. Okay, really, really that. And the one thing that stays with me is she explained me very carefully the classical design thinking methodology graphic, okay? It says, Jorge, the most important thing is that there's 2 phases. One where you diverge and one where you converge, right? What happens is that sometimes not everybody is in the same phase, right? So you need to be phrasing it, right? It happens at home. You want to go out with your wife, she thinks that you have already committed to a restaurant. Say, how about if we, so you create choices rather than make choices, right? Very, very important, right? So you need to be using your language from divergent perspective, how we thought about that, right? Sorry to move back into diverging for a second. Allow me to do that because I had an idea, okay? That's a very important thing, right? Number 9, validate before you build, okay? This is John Collins, partner in crime across many places, still part of the community here. He's very, very much in not to building, avoiding building something that nobody wants, right? And very, very important, this idea that making something nobody wants, this happens far too often, especially with tech push innovations, which involve the mistake of building something because you can. And that's what technology allows you to do. Because you can, you just do it. And it's not correct. It doesn't come from a med clinical need, right? Very important, the difference between the must-have and the nice-to-have. And there's people here in the room, right, that I know, that they were discussing with doctors for many months. Doctors were telling them that this solution was a must-have, but at some point in time they told them, right, it was a nice-to-have. Sometimes people find difficulties in saying, what is a must-have, what is a nice-to-have, okay? What is an aspirin, and what is the other thing? I forget, the aspirin and the other methodology, what is that? And then the question he uses a lot is, I've talked to 10 people, I've talked to 20 people, so fine, I don't care. Are you a decision maker, yes or no, right? If you talk to my family, if you talk to me, I have nothing to do at home, right? So I'm not a decision maker, right? My wife is, right? So it's important to talk to the real decision makers, those people who really can bend the needle, okay, very important. Yes, you need to do customer discovery, but do make sure that you talk to the right people. And number 10, health is one of the very few things that are truly important to everyone in the world. You might think this is stupid, but it's very important these days, right? This is Brian Lynn. He came for the graduation day in 2015. He's a professor at Stanford University, and very nice guy. We managed to get him la contra. The Biocat team managed to get him a la contra. He's like a Dr. House at Stanford, more or less, okay? Very, very nice guy. We developed a relationship. He even asked me to bet his application for tenure professorship at Stanford, which I did, which is, of course, my contribution to Stanford over the years, right? But the guy is very, 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 very interesting, right? 2 things here. He shared in La Contra, it's in Spanish, a letter that he was carrying always with him. Dear Dr. Lin, many thanks for taking care of me at my age. You treated me as you would treat your own father, with a sense of humor and unbeatable professional capabilities. It has been an honor for me to be your patient, right? It was a difficult thing because this thing got to him once the patient was dead, right? Had died, right? And basically he needed dialysis, daily dialysis, and he decided to stop it. So that, for him, that patient stopped his last days thinking of him, right? And then the other one, is a common sense, is if you hear noises in the dark, think of horses and not of zebras, because that's what normally moves at the dark. It's, you need to think of the common answer, right? The guy is very interesting, he just got a very complicated disease, right? He has never smoked or anything, but he has lung disease, right? He's dying, right? And he decided to do a last thing, so he created a class at Stanford, basically explaining what's the process of dying and how you can improve, the lives of others. Very important. And he's going to be publishing a book called Sunshine, which I encourage you to read. But this idea that we are very lucky because we work in an industry that cares about the outcomes, and that's important. So he never ever has smoked anything, but he has lung cancer. So imagine how difficult that is. Okay. Now. 5 more minutes and I'm done, okay? 3 key takeaways from former fellows that I want to do. So I talked to 15 to 20, very kind, some of them very last night and early morning today, so I appreciate that, thank you. First one that a lot of them share with me. The first thing that they shared with me was this, which is this idea that it takes the same amount of time and effort to think small than it does to think big. Exactly the same amount and effort, okay? So make sure that you dream big, that you think big, that you do things that are relevant. It's always worth it to aim high. Very, very important. I just came from Brussels, from one of these meetings that they have. This is not being recorded, right? No. And I had a little fight with the Minister of Health for Ireland because basically she was pretending that the next big thing for the European Union were 3 things that were totally relevant, right? So we need to really think in big and bigger about these things, okay? And this is a message that a lot of the people have shared with me these days, okay? The fellows that I interviewed, right, online. Second takeaway, very important, right? That's the story of shadowing. Shadowing is what you do for patients. We also had Diana do it for the team. So she basically followed the teams for one day, and then after that, she provided feedback to the teams, right? And I remember now a very good friend, she basically, Diana asked this fellow the following question: do you care about the other people in your team? And of course he said, of course, my team is super important to me, they are the nuggets of everything, I said, well, you've been interrupting them, you haven't let them speak, you haven't paid attention for part of the meeting, right? And I have a note that I was just listening before joining today, basically telling me, hey, this was really an eye-opener for me because it told me that, hey, sometimes what we say and what we do is different, right? And then we need to be really paying attention to this, right? Very, very important. Right? So we all, regardless of our position, we have some leadership capital that we put when we listen to people, when we respect to people, we add to this bank account, let's say, and when we don't do it, we subtract, and it gets more and more complicated. And that story, which is, it was a very good one, made me think of a story of my own, which is improv. I've never done improv except for one time. Improv, you know what it is? It's, you go on stage and then you say things. Let's put it this way, simply, okay? And I did a course some place in Europe once, and basically on top of that, they brought an improv professor, okay? And we were doing lots of exercises, okay? And if you ask me, I don't remember the exercises, but if you ask our group, all of us will remember this sentence that I'm going to say about in a second. Take care of your partner, right? Improv is all about saying things, but it's not the same saying things like, it was night, right? And you're not making it easy for the other person to follow. But if you say, it was night, and the lion appeared next to me, right? So you're making it easier for the other to follow, okay? So you're not thinking with your partner. You're not co-creating or co-developing. No, you're thinking for him to make it easier. In Spanish, we'll say dejarla botando, rather than leave it on the floor, right? So you try to make it so you do. So you take care of your partner. That's super important in terms of teams these days. And then the last one, the last takeaway, is about the community, because that's where all we started, right? So this is your community to the left, okay? This is your community. This is the Stanford people. So I encourage Biocat to bring all the 122 people for some time over the future, because that's the beauty of the program. That's the strength of the program, the people, right? That's what Anurag told me. Contribute, ask and return favors, help each other. This is really the thing. Because a community is not a network, okay? A community is shared identity, and that's a different thing, right? And this is one of the things that I think all the people that I interviewed told me, the fellows from previous years, they told me the best is the group, right? We're still seeing each other. We are seeing each other with people from different groups because, we had a system where it was a buddy from the previous year will help the new teams, right? And they talked, and they still go out 10 years after, so imagine. So the community, it is very, very important. So we're coming to an end. This is the time where those who have barely been paying attention will now come on stage and present their pitches. I will go back behind and do what I like, which is listening to the pitches. Very important, but it's very important. You're in healthcare. Don't leave healthcare. Don't leave healthcare. Very important. Sometimes we feel that we should leave it because it's really a difficult place. Feels like we never make progress. It gets complicated, right? So my last message is, do not leave because it is difficult. Stay because it is difficult, because we need talent like you to solve the problems we have. All these needs are still pending to be solved, okay? So with that, I thank you for your time and attention. I'm looking forward to the 6 pictures. Thank you very much.